25?
No, it's 25 for everything.
But you have to do subjective in 25 minutes.
Yeah.
Alright, your time starts now.
Don't do that.
Hi, I'm going to wash my hands. My name is Nicole. I'll be your student physical therapist today. Is that okay with you?
Yes.
Wonderful. Well, what are you here for today?
My shoulder hurts.
Your shoulder. Which shoulder?
Right shoulder.
Right shoulder. Are you right-handed?
Most of the time.
Well then, okay. So, what exactly happened? Are you in pain? I mean, how long did this start?
It started months ago.
Did something happen that triggered, or just over time you were...
I don't know, I'm drunk most of the time.
You're drunk most of the time. Okay then, can you describe
Saturday
the
night
pain
palsy.
for me, please?
It hurts.
It hurts. Is it achy? Is it sharp? Is it tingling?
That sounds about right.
Drunk Billy. That's gonna start.
Okay. So is there a sharp shooting pain?
I don't know. I've never been shot.
Okay. Does it feel like electricity?
No.
No. Okay. Well then, what do you do for a living?
I'm a jazz trumpet.
What? Is this preventing
Is he
you
like the
from
instructor?
doing anything
Aaron?
with
Okay,
your
Aaron's
job
like
or
giving this
any
more,
hobbies?
he's the patient, she's
Yeah,
going to like this
quite a bit.
patient.
I can only play it all over my thing.
You can't play your...
How am I shoulder?
Okay. And you can't point to me where it hurts? Just shoulder. Okay. What other hobbies do you have that you are limited in? I mean, can you, what makes things worse? Can you lift up your arm?
Moving my arm.
Just in general, just hurts. You can't. Okay, can you go forward at all?
That hurts too.
Can you do all of this, can you do with your left arm?
Yeah, I can move my arm.
Left arm fine. And could you do 2 months, before 2 months ago, could you do all of the same stuff with your right arm? That you
I
could
think
do
so.
with your left arm?
I never thought about it. I don't think so. I assumed I could.
Okay, so, just from gut instincts, I'm going to say that there might be a slap lesion, because with a slap lesion, you normally can't pinpoint where the issue is because it's so deep, so that could be one issue. I mean, honestly, it could be just frozen shoulder. In general trauma, I mean, there's always impingement, but impingement you can normally pinpoint what's wrong. So, my first instinct is slap lesion. Can I continue?
So you have slap lesion,
Slap lesion.
impingement,
Slap lesion, impingement,
frozen shoulder,
frozen shoulder, it could be tendonitis, bursitis,
tendon and one person.
the supraspinatus or the biceps tendon. Okay.
Cool.
Awesome. So just from general observation, I mean, I'm going to be noticing if he's trying to, well, one side is lower than the other side. Thanks, Ian. So his left side is lower than his right side. Since he is right-handed, you would expect his right shoulder to be lower than his left side. I'm sorry, most of the time he's right-handed. You also want to look for any like contours. So can I ask him to take off his shirt?
Take off your shirt.
And I'm going to ask you to take off your shirt, please.
It was much more
Thank you.
difficult.
Okay, so are you looking for any different like attributes?
Swelling just set in.
Sorry, guys.
Are you noticing any swelling?
Any swelling?
Yeah. Or atrophy?
That looks swollen to you? No.
Not swollen. Okay. Do I see any sulcus? No, nothing, no contours or anything like that. Nothing. Okay.
That looks about normal.
Okay. And I'm gonna have you walk a few steps that way, and I'll tell you when to stop, please.
What are you looking for?
I mean, clearly he's leaning towards one side over the
Which
other.
side is he leaning?
He's leaning towards his left side. So, I mean, he clearly doesn't, what, oh, you're fine. He was kind of guarding his right shoulder. He wasn't really moving it as much. He had more sway with his left side. and that was my dynamic observation. I could do that one as well. Anyway, so moving from observation, I'm going to go to examination of movement. So I would do everything with his left side first, just to check active range of motion. Is it clear on that side? Awesome. So moving on to your right side, and you can sit down. I'm going to have you. Can you go like this for me, please? Can you go any higher? That's okay. Are you in pain?
It hurts.
Oh, okay. Can you go forward for me, please?
Hurts.
Backwards.
No, that hurts too.
Can you go like this and like that? No, nothing. Okay. Well done. So since he didn't clear any of the active range of motion, I can move on to passive range of motion. And I'm going to take a hold of your arm and shoulder, and I'm going to do some movement. Tell me as soon as it hurts so I can stop, okay? I don't want this to be incredibly painful for you.
That's rude.
Even touching of it. With all motions.
I don't know what you're going to do. Oh yeah, that hurts too.
Can you bend your elbow?
Oh, yeah, the elbow's fine.
Elbow's fine. Can you look down for me? Look back. Look to the side. Both sides. That way.
Oh, that hurts.
Okay, so your neck is hurting you as well.
No, it hurts my shoulder.
Is it replicating your pain?
I don't know what shoulder it is.
Are you experiencing the same pain that you experienced? It hurts here. Here, right there. So you can pinpoint. Okay.
My neck hurts.
Your neck hurts.
Makes this hurt.
Your neck makes that hurt.
My side bent.
Okay. So since he's having neck issues, I would definitely do the vertebral artery test just to clear the neck. Is he okay? He's fine. Okay. So, I'm gonna have you. Don't let me. Oh. Oh, you good?
Maintain good posture.
Okay. Don't. I'm gonna have push against your head. Don't let me move you. Okay. I'm gonna push against the back of your head. Don't let me move you. Okay. I'm gonna push this way. Don't let me move you. Okay. I'm gonna push this way. Don't let me move you.
That hurts my shoulder.
That hurts your shoulder.
Okay.
When I have him go like that.
When you do all.
When I do all of that.
Not bad. Leave it.
Okay. So now I'm thinking there's going to be a nerve root problem at the cervical level because when he moves his neck, it's eliciting shoulder pain. Okay. So,
Not what you said.
okay, so I'm going to have you lie down with your feet facing that way and your head up here. Okay? And I would have a stool.
Yeah.
Okay, and
It's a
I'm going to have
miracle.
you scoot a little towards me. What I'm going to do is just take a hold of your head and I'm going to move it around a little bit. Okay, that looks good. Just relax for me. I have you, and just tell me when you're experiencing the same pain that you normally feel. Feels good? And relax for me. You're bad at relaxing. Okay, so all of that makes you feel better.
Yeah, just a little bit of a stretch.
Okay, so does this make you feel better? When I'm pulling on it? Makes no difference. Okay. Oh God, I don't know what this is. Okay, you can.
Well, she's clearing the neck right now with like a peripheral joint scan because you complain of neck pain.
Okay, I guess I'll move on to myotones. So I'm gonna have you sit for me, please.
I don't know.
Got your head? Okay. I'm gonna have you look forward for me. Or, yeah, bend your head forward a
So
little
if
bit.
they experience pain, if they experience pain in the neck, you do special
Any
tests
pain?
or anywhere
Just
with
a
a
little bit.
peripheral joint.
My shoulder right.
Okay, I'm gonna have you bend your head this way for me. Oh, you
No,
can't.
it hurts too much.
Okay, so 1, 2, 3, 4. So that's a C4. Okay, so next I'm going to move on to, can you bring, well, since it's your right arm, can you bring your left arm out
She
for me,
tried to.
please?
He couldn't get it out.
Shall I move you?
Well, that was just for passive range of motion. He couldn't raise it up.
Left side.
Left side's fine, okay. Well, I mean, I can't do it on this side. What happens if you can't do a minor from one that affected side?
Did you do any passive range of motion?
Hang on 1 second.
Did.
Yes.
Yes, she did.
Yes, yes.
Proper positioning.
Oh.
What's proper passive range
Are
of
you
motion?
happy lie down
Supine.
for me, please?
Supine.
Okay. I'm going to take a hold of your arm and I'm going to move around a little bit, okay?
That's right.
Oh, that's hurting. That's hurting. You can still move it though.
And still
It's
move it?
hurting. Ah, that hurts.
Okay.
That hurts a lot. Stop
Okay.
that.
Stop it.
Can I have you bend your elbow, please? Again, I'm going to passively move it.
That hurts.
Okay.
Makes
Internal.
me riot and pain.
You guys are mean. Internal.
Oh, yeah.
Same. Is that better from passive range motion?
Yes.
Okay.
You got a little more motion out of it.
Got a little more motion out of it. Okay, good. You can hold your head now. Okay. I'm just going to move on to functional assessment because I don't know what to do with you with examination of movement. So with functional test, I would definitely give you the upper limb functionality test index, and that is going to have a, if it's 9, it's a notable difference. So I see right on that
21.
21, so that's a mile. That's a mile on the right side. 21?
Out of 80?
Okay. Well then, you have no function in that right arm. Okay. Next, I'm going to move on to special tests. And I have no idea. So if you're starting with your cervical, you're having a problem at your nerve root, but you have no tingling and nothing like that. So if it's impinging on a motor nerve, then I can test. What? Okay.
Nicole, you're doing it really good.
You are doing good.
Fine.
Thank you. I'm feeling really self-conscious right now.
So
Okay.
walk me through. What did you do from that told you he was getting impinged on it?
Well, as soon as I moved it, I mean, he said it felt better. When I distracted it, he said there was no difference. So, like, I'm not thinking, what?
No difference
No
with
difference
distraction.
with distraction.
But
But,
any difference with passive range of motion?
yes.
But you said yourself there's no tingling down the arm,
No
so it would
tingling
be,
down the arm.
it would be the nerve then.
So- But if I'm impinging that muscle or that, like, a
Impinging is a
motor.
very strong nerve.
It is a very strong.
Really?
Yeah.
Okay, so I'm compressing a motor.
So tell me what motions with the neck specifically, actively, not a resisted, cause impact.
I don't remember. If I did
See,
last night.
you did do it, but you did get pinned, but you
Left
left.
side.
Left side flexion, yeah.
Pain in his right trap.
You're doing fine. These are the things that the teachers are looking for that they don't
So,
teach.
left side.
Amen.
Left side
Give me a
flexion.
coin.
Right. Right.
Yeah.
Right trap.
I'm not deleting mine.
If I side flex to the left, am I impinging on any nerve roots on the right side of my
No.
neck? No. If anything, I'm opening them up.
Yeah.
You probably won't see any impingement doing this. You'll see it in this and you'll need to extend it.
So then
So
there's
left
something
side flexion
with
is
stretching.
impinging
So stretching
something.
the muscle, and if I'm
Or
stretching
no,
the muscle,
no,
then,
never mind, it's not.
um,
Because it's stretching this.
okay, so that's leading me to believe that.
She said C40.
Yeah, it'll just reproduce the active range of motion.
Yeah, 'cause
again.
couldn't
Again, you guys can all watch it again.
Couldn't do a strut.
I'm not getting anything. Do you see anything awkward with my arm movements compared to
Yes,
this? What do you know from kinesiology?
that you should be able to do that with that.
Okay, that's an easy answer. What about the scapulohumeral rhythm?
When,
It doesn't go away. It's always there.
no, it doesn't.
Do I have
He's,
any on
he
my
has
side?
none.
No.
He's only getting gloma here.
So if you don't have, so then that, something is torn.
Oh, no,
Mm.
you don't know that.
Don't it? It's just
You know that the biomechanics are off.
Okay.
So that would lead you to like, okay,
So the scapula or
something with the shoulder.
something with the shoulder, okay. You threw me off the neck.
No, but that's what they're gonna present, that's the
Okay.
idea.
Okay.
The neck is connected to the shoulder bone.
Yeah. Okay, so,
You're doing great. You are, don't worry about it.
so with special tests, I am going to,
So what special test do you want?
I think I want to do
Just did it
a
just
speech
it's not
test and
known.
an O'Brien's test just to keep going with the slap lesion because I really think something is wrong
Big
with
crime
that.
How are you
or
going to?
Well,
instability.
for the speech test,
Yeah, I don't think so.
and
With your current patient, how are you?
He can't.
Guarding.
I
That's
can't.
He can't. 'Cause he
Okay.
can't do it.
Cause I mean, well, okay, with, aren't they,
I should try to figure out.
Yeah.
can I, okay, I
I
wanted
would
to
just
do,
start with something.
You would find.
Hey, we're getting frustrated with you too, or not with you at this. Well, at the same time.
He cannot actively or passively get into any special test position. Your first thoughts were a slap lesion, some sort of impingement, some sort of tendinosis, maybe a tear. What can you rule out with no active movement as this? And I emphasize this.
so, pretty much he's substituting with his trap then. So if he's substituting with his trapezius,
I think you're right.
Which one of those diagnoses do you rule out?
That's what I think it is.
Impingement, slap, tendinitis,
tendinitis is gone.
impingement? Can he get into a position to impinge?
No, so impingement is gone.
Slap is not going to.
Really? It won't? Okay.
No.
Man, I was like on, I was like, I got this. This
You
is
guys
tough.
are way too diagnosed happy.
Okay.
Don't wait.
Then
We're supposed to give a guess at the beginning, right?
could there,
4 guesses? I thought it was just 2. Oh, mother. Okay, so standard impingement, tendinitis,
how about a
tear.
rotator cuff pathology?
What kind?
If he's substituting with this upper trap, I'm gonna say the supraspinalis.
What would be wrong? If he can't do any dynamic real shoulder movements like this,
Yeah.
you think it's just impinged?
Yeah.
Torn, break, gone, toast?
Yeah.
Will he have diffuse amounts of excruciating pain with a completely torn tongue?
No,
Will he have any pain?
no.
That.
This could be a partial tear though, couldn't it? Or tendinitis.
Is it really that simple? Is it AC?
AC what?
No, it's not easy.
It's,
It's
okay.
no.
What? Ian.
Oh, it's not.
I don't.
See, that's why I want Ian as my patient.
No, wrong.
Ian, is it this?
So
No.
if I go like this,
That
that
hurts
hurts.
squeezing.
What?
It hurts when you're
It
squeezing.
hurts where I'm squeezing, but that's not, does it replicate your pain?
Well, yeah, you're squeezing, that hurts. I thought you were going completely different direction. Think about, what was one of your preliminary diagnoses? It's the only one left that makes any sense in this case.
And I said it?
Yes, you
Already
said it.
said it twice, actually. I repeated it.
You know what it is?
Okay, so I said a slap lesion, I said,
I hear I was cold.
I know, it's freezing.
oh! I
Oh,
think
that's
it's
mean.
tonsillitis. Okay,
Is
this upper, okay, yeah, it does, but we don't have any tests for that.
No, you don't. But doesn't mean you can't get it.
Okay, so, gathering all of my information together, okay?
Negative tests can be just as good as positive.
Yeah, okay, so, I mean, I can't do any tests, so if I.
You did the
That was like a
particular-
trick.
I'll give her a 90. I'm just kidding.
You could do add sign, you could force him into a passive range of motion. Because what is he, the guy's flag? Are you not allowed to move them past where the pain is? Or can you just crank the crap out of their shoulder and not make a difference at all?
Yeah, they're gonna hate you.
Are we a loving people?
Heck no.
That's it.
Hey,
Look where your head's at. That's
no
what it
pain,
is.
no gain physical therapy.
Sometimes it's gotta be correct.
Yeah, I think it's funny.
No, the thinking is right. I mean, you're there, but don't jump to like a, it's gotta be this, this. Don't compartmentalize, just think. Just think openly about what it could possibly be, everyone's gonna be different.
Okay. So, gathering all my information together, clearly he can't move it, it's frozen, I can't do, I mean, I did the vertebral artery test, I can bring him into a passive motion, and, I mean, if I try and do the, like, the Nears or the Hawkins-Kennedy exam, I'm not gonna be able to get him into it. So, I mean, all of these tests are gonna be negative. I'm
Could
clear.
you do instability test? Like sulfate sign at 0?
Yes, I can. I'm gonna have you
She
relax.
has to do
for
the
me.
apprehension test, possibly.
And I'm going to be pulling at your arm. I'm gonna be looking to see if there is any,
If nothing happens.
Nothing
keep on
happens,
going. He just
okay.
screeches in pain.
screeches in pain. Okay, so that's another negative exam. So those are 2 negative exams. None of that. I'm gonna move on from these stupid special tests. So after that, I'm gonna go. I'm gonna go on the
Just start doing
reflexes.
tests.
After,
They would always be
with
starting to show
reflexes, I
just
mean,
all start
nothing
being negative.
nervous
Is that what they
I
were
mean, I
trying to
can
get at?
Yeah, I
biceps
think
and
so.
triceps, but again, nothing nervous is coming up. But if I want to do biceps and triceps, I just see
like,
what I can see 7.
How would you test triceps?
I would have said patient relax for me, which he has a problem with. I'm gonna have you sit with your feet on this side, please.
Feet on this side. This,
You can
No.
bring it off.
okay.
I come like this, and he relaxes for me, and I bring the reflex hammer and go like that. It should come off. We already said, we don't care about pain with adhesive capsulitis. So with cutaneous, again, the same thing, I could do all of these just like the tones, but again, nothing nervous coming up. If I want to do them, close your eyes, please. What am I touching? Where am I touching? Do they feel the same? Where am I touching? Do they feel the same? Same. You good?
Good. Last one, pick.
After that, I would move on to joint play. I'm going to have you lie down with your head straight, please. I have your shoulder. I know this is painful.
Open past the shoulder.
Are you okay?
55 and 38.
It's going to be a 23 susception, so I'm going to bring you into it. It's going to hurt like a baby.
Don't say that.
You know those 3 professionalism points?
Gone.
We only get 3? Oh, I was hoping that was 30.
Okay, so
He's still got 2 or 3 years of this. It goes away.
If it goes away.
So you should relax for me. This is helpful.
You can do that. No, you would have to do every direction.
So
You'd have to do a
after
posterior
joint play, I
glide,
move on to
inferior glide,
palpation, so I can
and then flip them over.
feel around.
Yeah.
That hurts. How
Oh,
about
oh,
with-
that hurts.
Oh, that hurts.
For all directions, right? For the joint play.
Oh, right there.
So, after palpation, have you had any diagnostic imaging? I'm going to diagnose you with adhesive
Whoa, whoa,
capsulitis.
whoa, whoa, whoa. I know we could do that.
What?
That was good though.
That was good.
Good job.